So nurses walked out yesterday. There's another strike next week in England, Wales and Northern Ireland. You're an A&E doctor. Do you support what the nurses are doing?
Yes, I do. Well, nurses and healthcare workers, so more broadly, have seen their pay being eroded over the past decade or so. And over the past year, it's just fallen off a cliff. And sort of that balance between how difficult the job is, which has become more difficult over the past few years, and sort of what you're remunerated for as a result of it, that mismatch has just grown. And that's what's led to these strikes. We're seeing sort of record levels of quit rates among nurses as well. So that's one option. But for the people who want to continue to be a nurse, they're using pretty much the only voice mechanism they've got left. They've tried other ways, the government hasn't listened, and so now it's about industrial action. And the hope would be that someone will finally respond to what they are saying.
And you're not part of the dispute as a doctor, but what's your reaction when you hear the government say, we can't afford a 19% pay rise, there just isn't the money there, and we're following the advice of the Independent Pay Review Board. What do you make of that argument?
Well, I mean, the government has a pretty simple question it should be asking itself, which is pay in the health service at a level that can maintain services at the level I want them to be, at the level I'm promising, right? And the answer to that, quite plainly, is no. So you have two options. The first option for the government is to come and to sit at the negotiating table and to revise their pay offer, to set pay at a level that fills jobs, to set pay at a level that ensures the NHS performs at a standard that we all expect it to, that the government wants it to. The second option for the government is actually to come out and to talk to voters and to tell the public that actually public services are going to deteriorate, they're going to deteriorate further, and that we need to get used to that. There's a new normal, and that baseline of what we expect from the health service is now lower. Those are the two options for the government. What they're doing right now, which is letting inflation erode wages, but still saying services can be maintained, that, just from an economic perspective, is plainly dishonest.
OK, and they argue that they're putting lots of money into the NHS, don't they? If there isn't a resolution, do you expect to see more strikes to come? The RCN is saying that that is the case. If there aren't negotiations and there isn't progress, we can expect more after the ones next week?
I think that's right. I think there will be more strikes if the government continues with its line. I suspect those strikes that come in January will be more severe and more coordinated and will lead to greater disruptions. So I mean, the offer the RCN has made to the government, which is, if you sit at the table, we will suspend the strikes. That feels, I think, to most people like a pretty reasonable offer to have made. But if the government continues to say, no, we're staying hardball, then I suspect the strikes to come will be more disruptive.
What about patient safety? Do you have concerns? You work in A&E yourself. I know you haven't worked this week, so you can't comment on what effect the strike had yesterday. But do you have worries that during strikes, emergency care is compromised?
Right. I mean, there's sort of two ways to think about how the strikes affect patient care. There's what it means for patients in the immediate term, what it meant for patients yesterday, what it will mean for patients next Tuesday, next Wednesday. And then there's what it means for patients over the coming months and years. So let's take each of those in turn. What does it mean for patients in the immediate term? Have services been disrupted? Yes. That's almost how the strike works. That's the voice mechanism. The disruption to the normal running of healthcare services is the voice mechanism here. They've been organised in a way to minimise disruption to sort of critical services. So most of the disruptions have happened to outpatient services, to planned care, to non-emergency operations, and sort of certain services like children's emergency services are being staffed at normal levels, A&E services are being staffed at bank holiday levels. So basically it's an effort to mitigate the harms that would come around to patients as a result of disruptions. But disruptions are happening. Access to care is being disrupted. The key thing to remember here, I think, is the counterfactual. So if this industrial action wasn't happening, do we have a health service where safe and timely access to care is the reality? And quite plainly, the answer to that is no, right? And that leads me on to the second point I wanted to make. Well, what's the impact of these strikes for patients in the medium and the long term? Which is, if the industrial action is successful in negotiating a better pay offer for the nurses and for healthcare workers, well, then that will lead to a larger, more satisfied, more productive workforce, which in turn will lead to better quality care and better access to care for patients. So in the long run, this could be in patients' interest. And certainly that's what nurses are arguing.
Of course, and yet people who are in an emergency situation are not going to be thinking about the long term. They think, am I going to get my care now? And there are warnings that next week's ambulance strike could actually be even more compromising as far as patient safety is concerned. Do you have that worry?
I do, yeah. I think the ambulance workers' strikes on Wednesday poses a different sort of risk to patients, and it's quite hard to see how that plays out. Again, they are being planned in a way to try and mitigate the harms that would come around. Ideally, that no one would become severely unwell as a result of not being able to access care, right? So the conversations are going on between unions and between providers to ensure that can happen. It's hard to see how it plays out, and what the unions will argue and what healthcare workers are arguing is that the ball's still very much in the government's court, and they could sit down at the table and suspend these strikes.